Hello viewers and my dear students, I welcome you all in my surgery online class, and today topic of discussion is Idiopathic Thrombocytopaenic Purpura. The short name is ITP, Idiopathic Thrombocytopaenic Purpura. We all know that what is the function of spleen. Sequestration of the platelets occur in the spleen and spleen produces antibodies. So whenever any infection occurs, the antibodies are produced in the spleen. So also it is a reservoir of RBCs that we have done in the previous and the last lectures. Now what happens in this ITP, Idiopathic Thrombocytopaenic Purpura? There is production of antibodies against person's own platelets. So the formation of antibodies is going against the platelets. So there will be low platelets. Platelets will get decreased, diminished in case of idiopathic thrombocytic purpura. Now what are the causes? It could be during infections. So during infections, septicemia, there is low production, there is consumption of more platelets. So the consumption of platelets will increase during the infections and septicemia. Then during infections like SLE, infectious mononucleosis, in this SLE and infectious mononucleosis, there is more destruction of platelets. Then there is decreased production of platelets. Due to aplastic anemia, or when the person is consuming cytotoxic drug, so when patient is taking more cytotoxic drugs or a person is having aplastic anemia, there will be less production of platelets. There is less production of the platelets. The more destruction of the platelets will occur in cases like SLE, infectious mononucleosis, and there will be more consumptions of platelets during the stage of infections and septicemia. Beside this, there will be increased fragility if the person is taking steroids. So there will be increased fragility of the capillaries. Capillaries will easily bleed if the person is taking steroids. Now females are having this disease more. They are prone to get this idiopathic thrombocytopenic purpura more in compared to the male. So the ratio is female-male ratio is 3:1. So females are at higher risk. Now clinical
urology features are hematuria and diuresis. In musculoskeletal, there is painful swelling of hands and feet.
Hemorrhages. The hemorrhages in spots. There will be ecchymosis. What is ecchymosis? Discoloration of the skin due to the extravasation of the blood. Discoloration of the skin due to extravasation of the blood. That is ecchymosis. So there will be discoloration of the skin, and there will be purpuric hemorrhages or purpuric patches. Purpuric patches over the skin. that will be in sports, and these are mainly on the areas like buttocks, limbs, usually lower limbs. Why lower limbs? Because these are the pressure points, pressure areas, and there is more intravascular pressure on these areas. So this petechial hemorrhages in spots will be seen mainly on these areas, buttocks and limbs, because these are having the more intravascular pressure, and there will be ecchymosis, that is the skin discoloration due to the extravasation of the blood. Beside this, there will be anemia. So there will be features or symptoms of anemia like pallor, dizziness, weakness, fatigueness, lethargy, or vertigo. So there will be general features of weakness and the anemia में जो symptoms present होते हैं वो. Then there will be because the platelet count get reduced. The normal platelet count is 1,50,000 to 4 lakhs cells per mm. So there are 1 lakh to 50,000 to 4 lakhs cells total. This is the normal count of platelets per mm cube. So this is the normal range of platelets. So in idiopathic thrombocytic purpura, there is production of auto antibodies. There will be formation of antibodies against the person owns platelets. So there will be destruction of platelets, there will be decreased production of platelets, more consumption of platelets due to aplastic anemia, cytotoxic drug or steroids or other infections like SLE, infectious mononucleosis. So there will be diminished count of the platelets. So there, as platelets will get diminished or decreased, so the bleeding time will increase. So in clinical features there will be like hematuria, that is bleeding in the urine. Then hematemesis, that is bleeding in vomit. It is bleeding in urine is hematuria, bleeding in vomit is hematemesis. Then bleeding gums. Then menorrhagia. Menorrhagia is what? Heavy menstrual cycle or heavy bleeding during the menstrual phase. This is menorrhagia. Then yes, epistaxis, that is bleeding from nose. So this type of symptoms you will notice in the patient, and there will be prolonged bleeding time, but the clotting time will be normal. So when the patient came to your clinic with the clinical features like petechial hemorrhages, spot hemorrhages or bleeding in spots in the lower limb or in the buttock side, or there are ecchymosis and the bleeding time is prolonged, then you can think of idiopathic thrombocytopenia purpura. Then beside this, there could be intracranial hemorrhage also. Intracranial hemorrhage. So in that condition, if the bleeding occurs in the intracranial hemorrhage if occurs, then there will be sudden death, because the bleeding is in the cranial. Then there is one test to confirm. That test is known as Hess tourniquet test. Hess tourniquet test. A tourniquet is applied, and then you will notice that there will be 20 spots, 20 petechial spots in a circle of average 3 cm. So there will be 20 cartilaginous spots in a circle of average 3 centimeter. So you can confirm that person or the patient is having this ITP. This is the Hess tourniquet test, and this circle is cubital fossa. So this is a test to confirm idiopathic thrombocytic purpura, Hess tourniquet test. In investigations, complete blood count is must, that is CBC. Their platelets will be low. Platelet count is low. Then bone marrow biopsy. This is very important, bone marrow biopsy. So there will be more precursors of platelets. More precursors of platelets. So if there are more precursors of platelet in bone marrow biopsy, then this is the positive sign that patient is having idiopathic thrombocytic purpura. Then the third investigation is when the bleeding time is prolonged. But normal clotting time. So the clotting time is normal, but the bleeding time is prolonged, and the bone marrow biopsy shows more precursors of platelets, and if the platelet count is low in complete blood test, then you can think of idiopathic thrombocytic purpura. Then in treatment, corticosteroids are given. So if the child is affected, then first try to resolve the case by giving the corticosteroids, especially prednisone. So prednisone is the choice of medicine or the choice of corticosteroid given to the children, and spleen is palpable. Usually spleen is palpable. So when you will examine the patient, the spleen is palpable, and if the treatment doesn't responds, then go for the surgery, remove the spleen, that is splenectomy. So this is the last way to go. If the medicines or if the corticosteroids don't work, then splenectomy is the only way.